GLP-1 drugs that took off as popular weight loss medication are now showing promising results treating the most severe of addictions. A doctor is spearheading a new type of treatment program for more than 130 patients in Pennsylvania and South Florida, all struggling with alcohol or drug addiction. He's helping patients curb those cravings using Mounjaro injections. Dr. Stephen Klein is a physician who specializes in addiction. He heads this project at Karen Treatment Centers. He joins us now. Doctor, good morning. Thank you for coming on.
Good morning, Hannah. Thank you for having me.
I'm so interested in this story. I have so many friends on these drugs. And really, when we go out to eat, not only are they not eating, they're not drinking either. They have no interest. And you started prescribing GLP-1s to your patients. What makes you so confident about this potential connection?
So there's really two things, Hannah. The first is that there's a growing body of evidence in both preclinical models using animals and then human data as well that shows that cravings and use of both alcohol and opioids decrease when these medications are being used. That's what builds my practice as a physician, but also as a human who struggled with food and also alcohol and drug addiction. My own use of these medications has been just transformative. I also think the last part of that is with, like you said, so many people using them, I think they're incredibly safe and incredibly useful way to help people struggling with the hardest parts of addiction.
Oh, thank you for also sharing your personal journey. That just shows that you've gone through it, you've done it. I want to ask about the science behind quieting the cravings, as these drugs have been described to do, not only with food, but according to your studies, also alcohol and drugs.
Sure. So the science itself is all rooted in the reward center. So the reward center of our brains is really what does everything. It drives all of our behaviors. I really think these medications work in treating obesity because obesity in its extreme forms can be thought of as an addiction to food. When I'm diagnosing someone with substance use disorder, I take them through the DSM-5 criteria, which is a series of 11 questions. I think many people would answer yes to these questions who are in the morbidly obese category as it relates to food. I think what these medications do is they go into that reward center and they make people feel okay without these substances, whether that substance be a cheeseburger, a beer, a line of cocaine. Any of these substances make our reward systems light up. These medications are going to the root of that. They're really going to the root of the reward system and taking away patients' cravings. It's really transformative, and I think it's going to change the entire landscape of how we treat and think about addiction.
Look, we've seen how transforming it's been with obesity, but I am curious here. When you use these shots for somebody overweight, you see the results. They're losing weight or not. How do you monitor and manage your patients? How do you know they're simply not just lying and saying, no, I didn't drink this weekend or I didn't do any drugs?
Sure. So I work in a treatment center. It's a large nonprofit treatment center in northern Pennsylvania called Karen Treatment Centers. Patients are staying with us for 28 to 30 days. So as far as them lying while they're actually in residential treatment, I don't have that concern. Also, I don't really think about patients as lying or not lying.
Sure.
I think about them doing the best with the tools that they have. This is just another tool in the toolbox. But what I'm observing as a doctor who sees patients during these 28 to 30 days is just a remarkable transformation. Even while they're with us, they feel better. They can focus more on the skills of recovery and less on the cravings that they're having. One of my favorite expressions is that alcohol or drugs are not the answer, but they make us forget the question. And patients are with us at Karen to remember the question. Why do they use drugs and alcohol? How can we help them live better, more productive lives that align with their goals? And I think, again, these medications are transformative in that end.
Yeah, and I think that insight that you just mentioned is valuable. The fact that you're monitoring these patients for over a month to see how they're dealing with addiction, that is an important point. The president announced just last week efforts to lower the cost of these drugs when it comes to managing weight loss. Federal regulators have not approved this for behavioral health issues. Where do you step in and others in the science and health community to help lawmakers understand the potential benefits, again, not just for losing weight, but possibly battling addiction?
Sure. So I think first off, I practice medicine in the United States. So many of my patients will meet the FDA approved indications for these medications, BMI greater than 30 or BMI greater than 25 with a pre-existing medical condition. I think when we talk about their use in specifically addiction of patients of normal BMI, then we're using something off-label. Off-label is not a bad word. It's something that we actually do all the time in addiction medicine. And it's really an ethical practice where we as physicians are weighing the cost and the benefits of using these medications. I think as we make the case to lawmakers, it's really when the proof is in the pudding. We need larger studies. We need to keep using them. We need to observe what they're doing, and then we need to be in a position to collect and leverage that data.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.